Good morning, everyone. I am Ruby Villanueva.
And I am Giselle Yu.
We are going to report about cyanide poisoning.
Many of us have frequent contact with cyanogenic substances. Most of the case reports involve genocide, suicide, homicide, and accidents related to the substances in this table.
As industrial precautions have increased, the numbers of cases of accidental cyanide poisoning have decreased. Today, accidents represent less than 10% of deaths due to cyanide. Cyanide can be a rare cause of suicidal death and is particularly relevant if a symptomatic patient has a ready access to the toxins. Common sources of cyanide include chokeberries, apricot pits, almond pits, cassava root, laetrile, amygdalin, hydrocyanic or prussic acid, and potassium or sodium cyanide, a photographic metal cleaning electroplating chemicals. Typical symptoms of cyanide poisoning include nausea, vomiting, burning sensation in the mouth, headache, dizziness, lethargy, tachycardia with dyspnea, and hypotension and cyanosis. Potential complications include coma, seizures, arrhythmia, pulmonary edema, lactic acidosis, shock, and cardiorespiratory arrest.
When cyanide is inhaled, symptoms are evident within seconds and the patient may be dead within minutes. When cyanide is ingested or absorbed through the skin or conjunctival sac, there is a delay of several minutes in the onset of symptoms, with death ensuing within 3 to 4 hours, depending on the ingested product, gastric pH, and whether appropriate therapy is instituted. Cyanide is a protoplasmic poison inducing cellular hypoxia.
Pre-hospital care. Establish the presence of adequate vital signs and create an airway, if necessary. Induce emesis if drug has been recently ingested and patient is asymptomatic, unless the patient is comatose, convulsing, or has no gag reflex. Administer oxygen 100% by mask or ventilatory bag. Administer amyl nitrite by inhalation for 15 to 30 seconds, oxygen for 30 seconds, then repeat. Transport the patient to a medical facility immediately.
Hospital treatment. Continue to monitor and maintain vital signs of the patient. Administer the cyanide antidote package. Perform gastric evacuation and administer activated charcoal and a saline cathartic if cyanide has been recently ingested and patient is not in serious condition. Provide supportive and symptomatic treatment as needed.
Contents of cyanide antidote package: 2 ampoules of 3% sodium nitrite, 300 mg per 10 ml, 2 ampoules of 25% sodium thiosulfate, 12.5 grams per 50 ml, 12 inhalant pearls of amyl nitrite, 0.3 ml per pearl.
Administration of cyanide antidote. Break the amyl nitrite pearls, one at a time, in a gauze pad and hold them under the patient's nose or place near air inlet or ventilatory bag for 15 to 30 seconds each minute. Prepare the other drugs while the amyl nitrite is administered.
Stop administration of amyl nitrite and give 3% sodium nitrite 10 ml IV over 3 to 5 minutes. For children, 0.2 ml per kilogram, not to exceed 10 ml. Observe for hypotension.
Without changing IV sites, inject 50 ml of 25% sodium thiosulfate. In children, administer 1 ml per kilogram.
An alternative dosage schedule for children is based on the child's hemoglobin concentration. However, time lost for a hemoglobin determination may be crucial.
Ba 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 na na, ba 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 na na, oh ba ba ba.